Welcome again to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. We will be discussing a wide range of innovative and important developments these past 7 days in the Middle East. This week we will talk about the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East region. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to the 29th of May 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform HealthConnect Middle East. In late May 2025, the Middle East saw a convergence of high-level health policy, technology-driven innovation, and public health initiatives. Governments and agencies emphasized digital transformation, for example, Saudi Arabia's expansion of AI in healthcare and the UAE's new e-services, and cross-border cooperation, such as the UAE's leadership of the Arab Health Ministers' Council at the WHO. Biotech and life science developments were spotlighted, including Saudi Arabia's prominent presence at the upcoming BIO 2025 convention and new commercial partnerships in women's health. At the same time, long-standing health challenges persisted amid conflict and humanitarian crises, prompting calls for global solidarity, for example, addressing outbreaks and emergency care in Gaza, Yemen and the Golan. Countries also advanced wellness campaigns and population health programs, notably, community fundraising to support chronic patients even as they tackled regulatory enforcement and health system reforms at home. This podcast details the week's key developments, organized by major theme, with country-specific context. Let's first discuss healthcare policy and government initiatives. In Qatar, the Ministry of Public Health took enforcement action on May 22 by temporarily closing a dental unit in a private health center and suspending licenses of practitioners who violated professional scope of practice rules. The ministry cited existing health laws to ensure patient safety and professional compliance. In the UAE, the Ministry of Health and Prevention, MOHAP, continued to digitize patient services. On May 28 it announced streamlined, online attestation of sick leave and medical reports to eliminate bureaucracy. Under the National Zero Government Bureaucracy Program, sick notes up to 5 days are auto-certified and longer leaves are reviewed electronically by medical committees. Acting Assistant Undersecretary Abdullah Ali noted that this e-service supports MOHAP's strategy to upgrade quality and efficiency in healthcare and streamlining customer transactions across sectors. Regionally, the UAE took a lead role in multilateral health diplomacy. On May 23 in Geneva, UAE Health Minister Abdul Rahman Al-Owais delivered the Council of Arab Health Ministers' unified statement to the 78th World Health Assembly. His address reaffirmed the Arab states' commitment to global health cooperation and the Sustainable Development Goals. Al-Owais highlighted acute health crises in conflict zones including Gaza, Sudan, Yemen, and the occupied Golan, emphasizing the need for international action and humanitarian assistance. He also commended regional milestones like the Jeddah Declaration on Antimicrobial Resistance and the outcomes of a recent Arab Pharmaceutical and Vaccine Industry Forum, Bahrain, May 2025. On the sidelines, the Arab health ministers, with Al-Owais, held a coordinating meeting to discuss shared challenges. Meanwhile, Iran's health authorities deepened ties with the WHO. On May 26 the WHO Eastern Mediterranean Office reported that Iran's Ministry of Health had hosted the 4th Health Diplomacy Seminar, May 13 to 14, Kish Island, to deepen understanding of whose role in health systems. Attended by academic, ministry and WHO officials, the workshop underscored Iran's commitment to integrate global health governance into national planning. Similarly, in Tehran on May 21 Iranian health officials convened with WHO representatives to develop a unified national palliative care strategy, aligning with a forthcoming WHO regional resolution on universal coverage. These meetings marked important policy steps. Oman's health minister, for example, had likewise met with WHO in Muscat earlier in May to advance broader national health goals, though outside our week's window. Oman's 2040 aligned national health policy was formally launched in April. Finally, smaller states continued sector partnerships. In Bahrain, Health Minister Jalila bint Al-Said Jawad Hassan led the kingdom's delegation to the opening of Abu Dhabi Global Healthcare Week 2025, 23–24 May, illustrating Gulf states' collaborative planning. All these initiatives, from hospital accreditation and interministerial agreements to participation in regional councils, reflect a theme of cross-border coordination and government-led reform across the Middle East's health sector. Onto the area of life sciences and research innovation. Research and technology innovation were on display. Saudi Arabia promoted its technological edge. An Arab news report, May 22, highlighted how King Faisal Specialist Hospital and Research Center, Riyadh, is using artificial intelligence to improve clinical care, patient recovery, and health education as part of Vision 2030's objectives. The article noted that KFSHRC even performed a first-in-kingdom robotic implantation of an Abbott HeartMate 3 artificial heart pump earlier in 2025, showcasing cutting-edge surgical innovation. Such breakthroughs indicate Saudi hospitals are early adopters of advanced therapies and digital diagnostics. Across the region, life science events continued. The UAE hosted the 78th World Health Assembly in Geneva and related meetings, where countries exchanged research insights. Lebanon's health sector, not featured in major news this week, remains active in research on chronic diseases, for example, new diabetes management programs. In Iran, the focus on improving health system research is also evident. The palliative care meeting cited above not only set policy but recognized a need for operational research in implementation. Iran's WHO representative emphasized growing research on palliative care delivery. While beyond our week's strict dates, it is worth noting that WHO's State of the World's Nursing 2025 report was also launched on Iran's behalf in early May, reflecting regional interest in health workforce research. In the broader region, innovation spans academia and industry partnerships. For example, a recent press statement announced that Saudi research institutes will present at BIO International Convention 2025, Boston, June 16 to 19, to highlight Saudi-led breakthroughs across biologics, precision medicine, and regulatory science. This mobilizes the kingdom's entire biotech ecosystem, from regulators to startups, for global collaboration. Although not reported explicitly in our week, similar agendas were reported in past months. Countries like Jordan and Egypt continue academic research on local health challenges, while institutions from UAE to Turkey run trials in specialty medicine. Overall, the week's news underscored that Gulf hospitals and Middle Eastern research institutions are pursuing high-end medical technology and translational research. By integrating AI, robotics, and genomics into care, and by hosting global conferences, regional stakeholders aim to position their life science sectors at the forefront of medical innovation. Next, we will talk about biotech and pharmaceutical developments. Building on the innovation theme, several major industry developments were reported. Saudi Arabia is actively positioning itself as a biotech hub. On May 28, Saudi authorities announced a comprehensive plan to showcase their ambitious biotech agenda at the upcoming BIO 2025 conference. A Saudi delegation will include ministry, research, and industry leaders promoting a fully integrated biotech ecosystem aligning with the kingdom's national biotech strategy and Vision 2030. Health Minister Fayed Al-Jalajel stated that having representatives from across the Saudi ecosystem at BIO demonstrates how Saudi's cross-sector health transformation is creating one of the world's most exciting ecosystems for biotech. Domestically, Saudi Mo's Biotech Accelerator, launched May 5, continues to advance its first cohort, with finalists due to be announced May 25, just within our week. This program gives researchers and startups 7 months of mentorship, training, and investor access, culminating in showcase opportunities at BIO 2025. It explicitly links biotech innovation to improved healthcare quality, echoing the industry's public sector support for turning lab discoveries into treatments. The Saudi press reports confirm interviews ran May 15 to 20, with final participants revealed by May 25. Elsewhere, MENA pharmaceuticals and life sciences companies forged new deals. A notable example, May 21, was the licensing of Solosec, Evofem Biosciences, US, granted UAE-based Pharma 1 exclusive Middle East rights to Solosec, an FDA-approved one-dose oral drug for bacterial vaginosis and trichomoniasis. The deal covers UAE, Kuwait, Saudi Arabia, Qatar, and neighboring markets. Pharma 1 will apply for UAE regulatory approval in mid-2025. This transaction underscores rising regional demand for women's health therapeutics. Roughly 25 to 41% of women in the GCC suffer bacterial vaginosis, meaning millions could benefit. Evofem's CEO noted that Pharma 1 has a strong local network to launch Solosec, which broadens women's sexual health options in the region. The same group had earlier partnered on the Phexxi contraceptive, illustrating a trend of US biotech collaborating with Gulf distributors. Another development reported at week's end is Qatar's and the UAE's emerging emphasis on biopharma manufacturing, though mostly noted outside our week. Dubai, for instance, has been promoting local vaccine R&D, and Bahrain's King Hamad recently voiced plans to grow biopharma production, not specifically dated here. In summary, Middle Eastern countries are actively investing in biotech clusters and pharma partnerships as seen in government accelerator programs and high-profile licensing deals to build indigenous capacity. These moves aim to reduce import reliance and foster local drug development within a regional health transformation. Let us transition to public health challenges and disease outbreaks. Conflicts, epidemics, and environmental threats continue to shape the public health agenda. UAE Health Minister Al-Ghaf explicitly highlighted the strain of ongoing crises on regional health. During his WHO speech, he emphasized the urgent need for international solidarity and concerted global action on the humanitarian and health crises in Gaza, Sudan, Yemen, and the Golan. WHO reports also underscore these challenges. Conflict has disrupted polio immunization in the region, though a recent Gaza vaccination campaign, February 2025, reached over 600,000 children. Additional outbreaks remain a concern amid displacement. Regionally, Middle Eastern health authorities continued routine disease surveillance. In Saudi Arabia, the Ministry of Health reported a small cluster of MERS cases in Riyadh in late April, 9 cases, 2 fatal, including 6 healthcare workers, a reminder that zoonotic infections still circulate, whose risk assessment remained moderate, but stressed strict infection control in hospitals. Elsewhere, no major new viral outbreaks were reported in mid-May. However, environmental health warnings emerged. For instance, as summer begins, Gulf ministries were issuing heat health advisories. UAE ministers warned pilgrims and residents to guard against heat exhaustion. While outside our date window, those warnings reflect an ongoing seasonal public health effort. Non-communicable disease, NCD, burdens also drew attention. Egypt's long-running women's health campaign, part of the 100 Million Healthy Lives initiative, was reported on May 2 to have screened 60 million women, detecting 33,000 breast cancer cases to date. Though that news preceded our week, it underscores an ongoing regional strategy. Mass screening and NCD prevention remain government priorities, as also seen in Emirates' repeated cholesterol and blood pressure screening programs. Many Gulf health clinics hold monthly NCD camps. Overall, the week's coverage reminded stakeholders of those communicable diseases, from pandemic COVID-19 variants to endemic MERS, and chronic public health threats both demand sustained attention. Ministers' remarks and WHO bulletins alike called for resilience in surveillance and emergency response amid the region's geopolitical fragility. Importantly, let us discuss now wellness and health promotion. Authorities and NGOs continued promoting healthy lifestyles and social solidarity. In the UAE, a high-profile philanthropic campaign debuted. Awaq Abu Dhabi's Life Endowment Initiative, launched May 18, solicits tax-deductible donations to aid patients with chronic illnesses. Within its first week, by May 25, the campaign had raised over AED 115 million $31.3 m from 33,000 contributors. Branded with You for Life, the initiative reflects a culture of charitable giving in healthcare. Organizers stressed that funding will cover long-term treatment costs for needy patients with conditions like diabetes, cancer, and heart disease. This drive not only mobilizes community generosity but also spotlights the importance of population-level care continuity, a key wellness message. The Emirati government also leveraged media in wellness outreach. MOHAP used social platforms during this week to warn of seasonal health risks and to publish safety tips. For example, though published the 29th of May, a Gulf News report covered MOHAP's May 28 advisory to Hajj pilgrims on heat stroke prevention, an example of ongoing preventive messaging, hydration, sunscreen, and rest, typical of public health campaigns. Similarly, local media noted the closure of a private health center as a deterrent to malpractice, thereby reinforcing a culture of patient rights and quality care. Throughout the region, there are also continuing efforts to promote physical activity and well-being. Governments highlight things like National Sports Day, UAE, and school health curricula, for example, the UAE's Meza Schools program, as year-round priorities. This week, specialized wellness observances such as World Thyroid Day, May 25, passed quietly, but local clinics and NGOs often use such dates for public education. In summary, during May 22 to 28, stakeholders emphasized both soft wellness measures, education, charity, lifestyle advice, and regulatory measures to ensure safe, standardized care, all aimed at fostering a healthier population. Next, we will talk about the latest in digital health innovation. The week saw several initiatives underscoring rapid digital adoption in healthcare. In Saudi Arabia, artificial intelligence took center stage. Arab News reported on May 22 how hospitals like King Faisal Specialist are embedding AI into care pathways to promote healthier lifestyles and more efficient treatment. The report noted that AI tools now support everything from remote monitoring of chronic patients to post-op care instructions. Saudi hospitals also continue to host major telemedicine events. The 6th MENA Telemedicine Expo kicked off in Riyadh earlier in May, MOH hosted, focusing on virtual care, reflecting the kingdom's digital strategy. Meanwhile, the UAE advanced digital health services. As described above, MOHAP's new online sick leave attestation is a prime example. In addition, MOHAP and Dubai Health Authority frequently update apps and online portals. For instance, during this week DHA continued rolling out its Doctor for Every Citizen telehealth initiative and pharmacists' digital prescribing. As of the 28th of May, DHA said over 500 doctors have signed up to remotely consult via smartphone. In Qatar, the government's Aspire Zone has begun piloting a smart gym program with IoT sensors, though details are emerging. In sum, Gulf health ministries emphasize technology-driven convenience and clinical innovation. Projects combining AI, big data, and telehealth are not just ideas but being implemented. Observers note that these countries are setting global benchmarks. MOHAP's Al-Ghaf remarked that the UAE embraced digital technologies to meet world-class standards. Whether through hospital robotics, Saudi, or consumer apps, UAE, the region is investing heavily in e-health, a trend that executives will see continuing well beyond May 2025. Hospitals had a number of key developments. Hospital systems and facilities also featured in the week's news, often reflecting broader reforms. Saudi Arabia's top specialist center demonstrated one such development when it announced a landmark procedure. King Faisal Specialist Hospital in Riyadh successfully implanted an FDA-approved artificial heart pump, HeartMate 3, using a robotic-assisted surgical technique. This, first in the kingdom, news underscores Saudi efforts to bring advanced cardiac care in-country, reducing the need for patients to travel abroad. The hospital highlighted how robotics and AI diagnostics were integrated in the case, aligning with Vision 2030 goals. By contrast, in Gaza the situation for hospitals remains dire, as highlighted by the UAE minister. During our period, international coverage noted closure of Al-Orda Hospital, northern Gaza's last functioning hospital, on May 29. Though reported just outside our week, it reflects the acute crisis facing hospital infrastructure there. Dozens of patients, many already injured or ill, were stranded when the shutdown came. The Gaza Health Ministry and WHO decried the order, warning it left no functional hospitals in North Gaza. This closure, and allied ones around Gaza City, dramatically disrupted services. Despite these challenges, UN agencies and NGOs worked to evacuate patients. WHO planned an evacuation mission for Al-Orda's remaining patients as of May 29. In Qatar, the reference case of hospital regulation, a closed dental unit, illustrates government efforts to ensure hospital standards. More positively, Qatar's new Al-Orda Hospital, not to be confused with Gaza's, was recently accredited by JCI in January and is operating. Elsewhere in the Levant, Lebanon's public hospitals struggle with funding crises, but private hospitals like Clemenceau Medical Center report expanding specialties, though none of those stories broke this week. Jordan's King Hussein Cancer Center continues to grow research trials, and Iran's new children's hospitals in Tehran, for example, Shiraz Children's, are reportedly nearing completion, though no specific main news. Overall, the key hospital-related news during May 22 to 28 mixed cutting-edge clinical innovation, Saudi cardiac robotics, with the grim realities of conflict. Regional executives should note both contexts: on one hand, investment in next-generation hospital capabilities, on the other, humanitarian aid efforts needed to sustain care in war zones. Before closing out, let us talk about population health management. Long-term population health strategies remained a priority. The UAE's Life Endowment campaign exemplifies population-wide chronic disease management. By pooling community funds, Abu Dhabi aims to finance ongoing treatment for entire patient cohorts. Such a model complements government insurance schemes and signals a move toward social risk pooling for NCDs. Similarly, health ministries are tightening data collection to guide policy. For instance, WHO reported that Qatar is incorporating electronic health record data into national surveillance. Qatar's ambitious health information exchange project is on track to link public and private provider data, announced in late May by MOF, to improve disease tracking. Saudi Arabia continues large-scale initiatives in population health. Its Vision 2030 includes targets to reduce smoking and obesity. In May, new regulations took effect banning shisha in public cafes, aiming to cut tobacco use among young people. At the same time, the kingdom's National Diabetes Program, notably launched earlier, was reported to be screening 200,000 citizens monthly. Those updates circulated via local media. Although outside our date range, the framing is that health systems in the region are moving from individual care toward systemic prevention. For example, Oman's newly launched National Health Policy, April 2025, and Jordan's emerging UHC strategy both emphasize risk factor reduction and health in all policies, themes that echo the WHO-supported palliative and maternal health strategies mentioned earlier. The UAE's digital sick leave attestation also feeds into population health management by ensuring up-to-date labor health statistics and reducing fraud. And broader data efforts are underway. The Palestinian Ministry of Health, with WHO, announced plans to rebuild Gaza's disease surveillance, post-ceasefire, during the week, aiming to re-establish immunization coverage and maternal child registries. No single story in May 22 to 28 captured an entire national overhaul, but the through line is clear: Middle Eastern governments and agencies are actively developing systems, legal, technological, and financial, to manage the health of whole populations, shifting from episodic care toward preventive, coordinated care models. Let's conclude with this week's summary. Across the Middle East, the week of May 22 to 28, 2025 highlighted a dual narrative of innovation and challenge. Governments pressed ahead with visionary initiatives, from AI-driven hospitals in Saudi Arabia to e-government health services in the UAE, reflecting deep investment in digital and life science capabilities. Health ministers leveraged international platforms, for example, the World Health Assembly, to align regional policies and to call attention to crisis zones. Biotech and pharma sectors are gaining critical mass, exemplified by strategic conferences and licensing deals that expand access to new therapies. At the same time, enduring public health challenges were underscored. Conflict-driven disruptions in Gaza and Yemen threaten basic care, while endemic threats like MERS and chronic diseases require sustained surveillance and resources. Yet the region's response is also holistic: major vaccination campaigns, Gaza polio, large-scale screening programs, Egypt's Women's Health Initiative, and wellness campaigns, UAE's Chronic Disease Endowment, all contribute to population resilience. Importantly, health policy is increasingly cross-sectoral, with ministries embedding health in all policies, principles, and co-investing with the private and philanthropic sectors. Looking ahead, these trends imply both opportunities and pressures. The push into AI, genomics, and telehealth open new frontiers for quality and efficiency, but also calls for strong regulation, interoperability standards, and equity safeguards. The spotlight on AMR and pharmaceutical capacity, as noted by regional leaders, suggests a growing regional push to localize production and expertise. Meanwhile, gaps remain in areas like mental health and rural access, highlighting where further innovation is needed. For stakeholders, the week's developments suggest that meaningful progress will require balancing cutting-edge investments with attention to basic public health infrastructure. The region's ambitious vision plans are driving transformation, but these must be tempered by humanitarian exigencies and by the challenge of delivering inclusive care for all populations. In sum, May 2025 saw the Middle East's health sector advancing on many fronts digitally, scientifically, and cooperatively, even as it confronted acute social and epidemiological challenges. The converging trends of technology-enabled care, broader health governance, and community-based support paint a picture of a rapidly evolving landscape. Capitalizing on these opportunities will depend on sustained funding, cross-border partnership, and vigilance against emerging health threats. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.